21-year-old, lots of hair loss. Looking to do hair transplant. Good idea or not? I'm 21 years old. Would it be a good idea to get a hair transplant this year or next year when I'm 22? Both sides of my family have lost hair, including my father. And all of them have only lost the front bit. I started thinning from the age of 15 to 16. My hair at the front is so thin you can see the skin, and there are parts where hair doesn't grow at all.
Thank you for your question. You're 21 years old. You submitted a photo of the top of your scalp, and you are asking this question, and you describe in your history that you started losing hair at a very young age, around 15 to 16, and that the family history clearly has hair loss on both sides. And you're asking, would it be a good idea for you to have a hair transplant next year at age 22? Well, to help you understand who I am and why I'm answering this question for you, I'm a board-certified cosmetic surgeon practicing in Manhattan and Long Island for over 20 years. Hair transplant has been a significant part of my practice during this time. I'm also the founder of Trichostem Hair Regeneration Centers, and I've been very well known for developing a procedure called hair regeneration, which has been very successful in our practice for the past several years. So I can tell you that we meet patients like yourself very often. We have patients who come to our practice from all over the world. One of the harsh realities that I think you have to come to terms with is that you have very advanced hair loss and you're losing hair very quickly. Hair transplant, in my opinion, and I think most of my colleagues who perform surgery would agree, is not likely to be successful for you. The problem is that the degree of hair loss you have and the amount of hair available for transplantation is simply, there's a mismatch. And so for someone like yourself, the limitations, given how aggressive your pattern has been, are unfortunately too great for transplant procedure. Now, you are probably aware of medical therapy, but I'll just summarize it for you. The two drugs that are used for male pattern hair loss here in the United States are minoxidil, which is not likely to be of too much value for you, a topical application, and finasteride. Finasteride is a drug that inhibits an enzyme called 5-alpha reductase. This is an enzyme responsible for the conversion of testosterone to dihydrotestosterone, DHT. This really only works in men who have DHT-sensitive hair follicles. Many times, younger people who have this aggressive hair loss do not respond to finasteride. I'm not dissuading you from trying it, but it is something that you should be aware of. We have unfortunately are in a time where finasteride is not everyone's favorite drug because of the concerns of long-term sexual side effects that were published in peer-reviewed journals. And so a lot of men, particularly in your age range, will not take finasteride. In our practice for patients like yourself, we have had success with a treatment called hair regeneration, which is our method and formulation of a material called acellular matrix, and combined with platelet-rich plasma derived from your own blood. We have 3 to 5 years of data that shows close to 100% improvement in male pattern hair loss. Now the challenge in your patient like yourself is, can we make enough of a difference? And the reality is that the more advanced someone is, the less volume of hair we're able to get. But in patients who are younger, we have had some remarkable results in people who we did not anticipate getting such good results. So I would say that if someone like yourself comes to our practice, we recommend doing the injection treatment as soon as is possible. Now, there are some people who don't respond to the treatment, and we still have yet to figure out why that's the case. We've done re-injections in those patients, and we still haven't gotten responses. But the male pattern population that we have treated, close to 100% have had responses where they've seen a cessation or stopping of the hair loss and thickening of their thinning hair. In some patients, we also do a second treatment that we'll do after approximately a year, somewhere between 12 and 18 months. We follow our patients very closely. We follow them every 3 months. We do microscopic photos, digital photography, and we really look at our data very, very critically. We have been so successful with this that we've now scaled with the company that we started called Trichostem Hair Regeneration Centers. So it has been my contribution for patients who, like yourself, to be able to intervene at an early stage and avoid the unfortunate cost and disappointment of hair transplant. What you have to understand is, again, with the mismatch, eventually you lose the existing hair and all that's left are transplanted, and very often the transplanted hair doesn't look very good, especially for a younger man. So I want you to learn more about this option, about hair regeneration, and also think about this in the context of where you're at. You may have to accept a certain amount of hair loss as a normal part of your look, but this is something that you have to decide. I think that in your position, my recommendation as a doctor and as someone who understands very well the benefits of having good hair is that people who are younger, in my experience, majority who come to us want to intervene. And so if we can stop the progression and restore some volume, I think that would be advisable. So I hope that was helpful. I wish you the best of luck. Thank you for your question.